If you're thinking about having your implant or Penile surgery and plan to travel for your surgery, this video is for you. Today, I will dig deep into the logistics of how to prepare and what to expect when you're traveling long distance to have your penile implant surgery. Hello once again. My name is Jonathan Clavell and I am a sexual health expert and penile implant and Penile specialist. We have many men who travel from outside of our city, state, and even outside the country and may be concerned about how to prepare for the travel and its logistics. Therefore, I decided to create this video specifically for you. If you're planning on having the surgery done with another surgeon, this video might help guide you, but certainly should not replace the instructions provided by your specific surgeon. Always discuss logistics with your specific surgeon. If planning to have your surgery done by me, Dr. Clavell, here is what you are to expect. Penile implant surgery in most occasions can be performed in an outpatient setting, meaning even if your surgery is performed in the hospital, you do not need to stay in the hospital after your surgery. Once your surgery is done, we wait for you to urinate and you may be discharged. Believe it or not, most of our patients are like you and travel from outside our state and even fly from outside the United States to our practice to get their surgery done. Therefore, if you're traveling to see us, we got you covered. So let's first talk about before your arrival. If we still haven't had our initial consultation, you will need to either call our office or request an appointment via our website. Our website is houstonmenshealth.com so that we can have a virtual consultation with you. You do not necessarily need to be seen in person in order for you to be scheduled for your surgery. If you have a complex situation, we can later coordinate for you to be seen in person the day prior or 2 days prior to your surgery date. After the initial virtual consultation and once you are scheduled for your surgery, I always recommend my patients to plan to arrive to our city 2 days prior to your surgery. Why? My goal is for this journey to be one that is stress-free. If you're here 2 days before the surgery, the day before the surgery, you can register at the hospital or surgical center if you have not already done so. You can also get familiarized with our city and where you will be going for your surgery. And most importantly, you will be stress-free. We know you're nervous and we understand that flight delays can sometimes cause even more anxiety. Therefore, we wish for your journey from the time you decide to have the surgery done and until you recover is a journey free of stress and anxiety. The day before your surgery, we want you to stay calm and relaxed. If you're planning to drive, you can come the day before the surgery, and if close by, you can even arrive to Houston the morning of your surgery. But if flying, I strongly encourage you to give yourself enough wiggle room in case your flight gets delayed. If you're wondering where can you stay, our office can provide you with several options of where to stay in the Houston area depending on your budget. So just call us and we'll give you that information. Another thing that I always try to encourage is for you to try to obtain all the prescriptions that you will need for your recovery prior to your surgery. If you pick up your prescriptions the day before your surgery, you do not have to worry about picking up anything in a pharmacy after your surgery, and you can go from the hospital straight to your hotel without any worries. If you live outside of the United States, I can only prescribe you medications if you are here in the United States. Therefore, if you're traveling from outside the country, as soon as you arrive to Houston, please contact our office and we can coordinate for you to pick up your prescriptions prior to your surgery as well. If you're not able to pick these up prior to your surgery, do not worry. We can always prescribe them for you to pick up after your surgery. Do I need to see Dr. Clavell prior to the surgery? Not necessarily. In most occasions, I do not need to evaluate you in person prior to your surgery. There will be certain occasions that I will like to discuss things with you further in detail, or if you have a complex situation, be it severe Penile disease or you need a complex revision surgery, I might require for you to be seen the day before your surgery for a physical examination. This is something that we will discuss during your initial virtual consultation. Now let's talk about what will happen the day of your surgery. The day before your surgery, if you haven't already been contacted, expect to be contacted by our surgical scheduler on when you need to arrive to the hospital or surgical center. In most occasions, we expect you to arrive to the hospital 2 hours before your scheduled time of surgery. Once you arrive, you will register. They will take you to the day surgery area where the nurses will get your vitals, make sure that everything is ready in terms of your health, and get intravenous access in order to start the first intravenous antibiotic. Once you are close to the time of surgery, they will transfer you to the preoperative holding area, and that's where I will see you prior to your surgery. If you have any questions, we can address any final questions before we go in. The day of the surgery, try to be relaxed. As with any surgery, sometimes delays can happen. Do not get discouraged if you have to wait a little longer beyond your scheduled surgical time. Some surgeries may take longer than others, and delays can always happen. However, we will get to you and perform your surgery as soon as possible. Once your surgery is over, we need to wait until you urinate for you to be discharged from the hospital. In most occasions, penile implant surgery and Peyronie surgery, if you also have Peyronies, are outpatient surgeries. I plan to discharge you back to your hotel or place of stay. If your insurance covers an overnight stay and you wish to stay one night in the hospital, we can also coordinate that for you. Let us know if this is something you wish for. However, most men prefer to go back to the hotel or place of stay after the surgery. Again, you do not have to stay in the hospital. Therefore, in order to get discharged the same day, we always recommend to have someone with you to accompany you back to your hotel and make sure you always remain safe. This someone can be anyone. It can be your partner, a friend, a sibling, family member, it does not matter. We have patients that sometimes even hire someone to help them get discharged the same day. If you wonder why this is necessary, when you are placed under general anesthesia, it will take time for you to be fully alert, awake, and oriented. And we wish to make sure that you make it back to your hotel safely. If you do not have anyone and plan to travel alone, please let us know in advance so we can try to accommodate you to have your surgery done early enough to allow time for you to recover your alertness and that you can get discharged in a safely manner later during the day and not late in the evening. One other thing, if you weren't able to pick up your prescribed medications, I can send these medications to a pharmacy near your place of stay. So do not worry, we've got you covered. When can I travel back home? The answer to that is as soon as a day after your surgery. If you're driving to Houston, you can drive yourself back home the day after your surgery. The medications that we will give you should not get you drowsy. However, please clarify with your surgeon prior to your surgery when is the best time for you to drive yourself back home. Even though you should be able to drive yourself, I always recommend to have someone else to drive you home. If you came alone and you feel comfortable enough, you can drive yourself back home. Make sure you clarify this with your surgeon before doing so. This is extremely important. If you flew in an airplane for your surgery, then I recommend you to stay in Houston until 2 to 3 days after your surgery. You do not need to stay in Houston for several weeks. It does not matter where you're coming from in the world. We've had patients travel from South America, Europe, Asia, Africa, Australia, the Caribbean, and they have been able to travel back to their countries 2 days after their surgery. Why 2 days? 3 reasons. Number one, the one thing that can immediately go wrong after your surgery is urinary retention. That means that you're not able to urinate on your own. This may sometimes happen after people go under general anesthesia and is not considered a complication. We will not allow you to leave the hospital without urinating. However, if you cannot urinate, we can place a catheter and have you come back the following day to the office to get it removed, or give you catheters so that you can catheterize yourself in case of an emergency. You will still have the day after your surgery to troubleshoot if this problem arises. Almost everyone is able to urinate on postoperative day number 1, so no need to worry. Number 2, after your surgery, I will leave a big and bulky dressing that keeps your scrotum nice and compressed. This dressing stays there for 48 hours or 2 days. Therefore, if you have your surgery on a Wednesday, that Friday or 2 days later, you can take the dressings off, shower, and go to the airport. And number 3, remember I will use a nerve block or local anesthetic to help control your pain for the first 2 to 3 days. Well, take advantage of that. If you fly out of Houston 2 days after your surgery, you will probably have less pain traveling while the nerve block is still under effect than after it wears off. You might also be concerned about an infection and wish to stay close. I get it, but remember, the risk of infection is extremely low, and these do not happen a few days after surgery. If you were to develop an infection, it is extremely rare that will occur the first couple of weeks. The few times that I've had infections, they tend to develop at least 3 to 4 weeks after surgery, or sometimes even more delayed than that. Therefore, I encourage you to go back home where you will feel more comfortable to recover 2 to 3 days after your surgery. Now let's talk about going through airport security with the penile implant. Many men are extremely concerned about what will happen when traveling through the airport. You will likely be traveling with the implant partially inflated, so it might be difficult to conceal or hide your penis. Most men are able to bend the penis from the base to help conceal the implant inside their pants. However, I always encourage you to wear loose-fitting clothes and a big shirt or jacket so that others around you are not able to notice what you have. Remember, every week we have men flying in and out of Houston for this surgery, and I still haven't heard of people getting dirty looks because of the implant. In regards specifically to airport security might already be used to patients traveling with penile implants. The penile implant does not contain any metal. Therefore, if you're going through the metal detector, you will not set off any alarms. However, if you're going through the airport scanner that has X-ray, the scanner might pick up that you have something there. Don't be ashamed of it. Just tell them that you just had penile implant surgery. Sometimes we might even provide an ID card you can show them. The only time I've heard of a patient being checked further was when traveling international, but that only occurred once. What do I do if I have a complication and I am not in Houston? If you have any concerns in regards to your surgery, the first thing you need to do is contact your surgeon. If I am your surgeon, you will contact me. I prefer for you to contact me first because as your surgeon, I know how to manage complications. You do not need to go to a local emergency room unless you have serious problems like chest pain, uncontrollable fevers, intractable vomiting, or other systemic serious complications. These are extremely rare. If there are concerns in regards specifically to the surgical side, to the surgery, contact your surgeon. I am here available for you. If you are flying from outside the country, we will coordinate ways for you to be able to contact me if you have any concerns along the way. If there are concerns for infections and you live outside of the United States, it is likely that I will give you a prescription for 2 weeks of antibiotics while you're here. However, you will only take the antibiotic for 1 week. The second week of antibiotics is for you to have as a backup in case there are any concerns. But contact me first. Do not take the antibiotics without my prior authorization because most of the time you will not need them. So now to summarize, when booking your travel, I recommend you to plan to be in Houston for 5 days. Arrive 2 days before your surgery and fly back 2 days after your surgery. For example, if your surgery is scheduled for a Wednesday, plan to arrive to Houston that Monday or Tuesday early in the morning and fly back out of Houston the following Friday. Remember one thing, as your surgeon, I wish for your visit to Houston to be one that is safe, efficient, and free of stress or anxiety. I will do my best to be with you during this journey and allow you to have a smooth recovery. If you wish to schedule an appointment, call us. I would be honored to help you. See you next time.